Core Confidence Life TV. On this presentation, we're going to be taking a look at HIV in the Latinx male community. To conduct this interview, we have the host of It's Just Us Radio and a Core Confidence Life associate, Charlene Bowden.
HIV diagnosis continue growing in the Latinx community, where 85% of new HIV cases among Latinos are among men. And a new report finds that many of them face social, economic, and even political obstacles when it comes to managing and living with HIV. Here with more details from the report called Here As I Am are Guillermo Chacón, President of the Latino Commission on AIDS, and Marc Meachem, Head of the U.S. External Affairs, Viiv Healthcare. Gentlemen, thank you so much for joining me today to discuss this topic. And also, I want to thank you for allowing me to address you by your first names. Guillermo, I'd like to start with you. Why does it appear as though HIV rates are rising in the Latinx community?
Yes, basically, according to the Centers of Disease Control, known as CDC, even though we are 18% of the U.S. population, the HIV infection, we represent over 25%. And this alarming figure is calling our attention, and we're very, very concerned. And the main reason is because in many places it has been not a sustained attention and focus on raising awareness and a better understanding how to connect with the diverse Hispanic Latinx communities. We summarize as Hispanic or Latinos or Latinx, but behind that is Mexican Americans, Cubans, Puerto Ricans, Mexicans, Central America, South Americans, Caribbeans. And then it's complex. We understand that, but require from a public health perspective to go a little deeper to better change these alarming figures that have been increasing over the years.
Yes, indeed. Thank you for sharing that. Marc, what is the initiative you're involved in as it relates to HIV in the Latinx community?
At Viiv Healthcare, we know that we're not going to disrupt the disparities we see in HIV in communities of color unless we really get out into the communities, engage with people, listen to them, and get their perspectives. And so we took a 10-month listening tour from California to Mayagüez, Puerto Rico, and spoke with over 1,700 Latinx, gay and queer men, and got in their words, what they see as the biggest obstacles and what some of the solutions might be to disrupt this disparity.
So, Guillermo, what have you found to be the biggest challenges facing this community?
One of the biggest, among some challenges is the lack of access to healthcare. We still struggle in many, many states for people to have access to healthcare. And we know that that's a major barrier in order to really access prevention and support services. And it's important to know and share to the audience is that in 1990 we have a law that is a very powerful law, the Ryan White Act. And that federal law provide a treatment for HIV for anybody that has been impacted by HIV, especially low-income folks. But we need healthcare as a complement component to that important federal law. The other piece is the level of stigma associated with the HIV, and the level of homophobia, transphobia, and xenophobia are real barriers for people to really feel welcome and be able to connect and navigate the healthcare. And finally, we have a strong segment in the Latinx community that is foreign-born. And then that segment is not very familiar how to navigate the healthcare, and then require for healthcare providers and community providers to better understand in order to provide better services.
Yes, those are some major challenges. And what are some of the barriers to care facing Latinx men?
One, very strong one is for people to really feel welcome And we truly believe that, especially if you're a young gay man, young gay bi man, you want to also see yourself reflected in the support services that you will be getting, plus the level of people feel isolated and marginalized. In many cases, families have rejected these individuals. And then the concept of family has to be reset and has to be an extended family and create safe space that people could gather and do something that this study here, as I am, put together, and is to listen to the storytelling of people, their testimonials about how to heal inside in order to feel better, to access care and elevate self-esteem. All those elements combined will make the difference in individuals and also the community at large.
Yes, it sounds like you're describing holistic health care, where we're not just focusing on the presenting issue, but all of the underlying issues that accompany it as well, especially as it pertains to mental health care. Marc, what are the key pieces of advice that you'd like to share with this community?
I think there are two. I think the first is we want people to have hope. Today's HIV epidemic is not the epidemic of 20 or 30 years ago. We have effective treatments and can allow people to live a long and full life with HIV. And also, being on effective treatment can eliminate the risk of transmission between partners. And I think the second thing is we want to take HIV out of the shadows. And part of this project is so that the voices of people living with HIV, they can be heard, that people can be seen, and we can really increase dialogue in the community so that we can link people to care and we can end the epidemic. And so we've captured this in this report, which is a really beautiful report. Again, it's called Tal Como Soy in Spanish. In English, Here As I Am. It's available in both languages at viivhealthcare.com. That's VIIV healthcare.com.
Thank you so much for that. This is really good information. In closing, is there anything that either of you would like to add to this?
I just want to add, as we getting close to end Hispanic Heritage Month, to remind folks that on October 15, we also observe National Latino AIDS Awareness Day, and I think the report will be a good tool to distribute and raise awareness about this urgent issue in the Latinx community. Thank you.
Guillermo and Marc, thank you so much. This is really good information. I'm sure that our audience has learned a lot and will take this information and share it with others as well. Again, thank you so much for being here.